IVF is also called in vitro fertilization, is a process whereby the process of fertilization between a sperm and egg, which normally happens inside a woman's body, is artificially done outside in a lab, where egg from a woman's body is taken out and fertilized with the partner sperm, and the babies, which we also call embryos in medical terms, are formed. These embryos at a very early stage and are then transferred inside the uterus of the woman, and a pregnancy results. There are several indications for IVF. The most common one of them is tubal factor, where the woman's tubes get blocked due to some infection or due to any procedures or any surgery where the tubes get blocked. One of the most common indication of IVF is tubal blockage. The other indications for IVF are severe male pattern infertility, where the sperm count is extremely low or the quality of the sperm is very poor, the morphology and the motility is very low, and where the couple has tried several cycles of conception through other methods like intrauterine insemination and have failed to conceive naturally or through intrauterine insemination. Such couples are candidates for IVF. Other common reasons are unexplained infertility, where both the husband and wife have tried several courses of treatment, and despite of trying naturally or other methods have failed to conceive, where the woman is of more than 35 years of age and they have a very poor ovarian reserve, or any woman who has poor ovarian reserve or very poor egg quality are the candidates for IVF. Some of the common indications of IVF are male factor infertility, like low sperm count or absent sperm in the semen, very poor quality semen, like very poor morphology, then tubal factor or any problem with the uterus. Then there are couples who suffer from unexplained infertility. There is no known reason. Such couples also may require IVF. Then ovulation disorders, severe endometriosis are some of the indications for IVF. Before any couple go for an IVF, they are usually, both husband and wife, both the partners are screened rigorously for to determine the real reason behind their inability to conceive. They undergo general health checkup as well as some fertility checkups, which includes their complete blood count, liver function test, kidney function test, and there are certain fertility tests. Ultrasound examination is done. If required, male may also undergo certain blood tests, certain hormonal tests. Once the investigations are complete, then the couples undergo through the procedure of IVF, which includes the woman undergoes stimulation of the ovaries, where she undergoes injections daily from her second day of period, starting from second day, and then it continues for around 10 to 12 days. Once the ovaries are ready, when the eggs mature, that time a trigger injection is given, and which is followed by 36 hours later by an egg pickup, whereby the eggs are retrieved. The steps of IVF usually include pre-investigations, pre-treatment investigation of both the partners, both female and male partners. The male partner is checked for semen analysis. The female partner undergo all the tests, including fertility test and complete health checkup. This is followed by the stimulation of female patient with hormonal injections starting from day 2 of her period. These injections are to be taken daily as prescribed by the physician, and they continue for around approximately 10 to 12 days of their cycle, and at approximately 12th to 14th day of the cycle, egg retrieval is done from the female body. These eggs are then fertilized with the partner's sperm in the lab, and the embryos which are formed are usually transferred approximately on the 19th to 20th day of the cycle. The pregnancy result of the checked on approximately 29th to 30th day of the cycle. So the whole procedure of IVF usually takes approximately 1 month. It is very important that couples follow certain pre-treatment care as advised by the clinician. These include that they should prohibit from any unhealthy lifestyles like smoking, drinking, and they should be very regular with their prenatal vitamins as prescribed by the clinician. And they should avoid any form of over-the-counter medications and herbal supplements, and they should follow a healthy lifestyle, healthy diet, and regular physical exercises, not too heavy, are usually recommended. Post IVF treatment, patient can have to continue with their normal medications and supplements as advised by the clinician. They should follow a healthy lifestyle, healthy diet, and avoid any form of smoke, radiation, and any form of alcohol exposure. Then they should continue with the normal routine work as before. They can do their normal day-to-day home activities as well as going to office. Strict bed rest is usually not advised unless there are any medical complications with the pregnancy.